Good morning, everyone. Before I begin, I'd like to thank members of the media for joining us this morning. My name is Sharleen Stewart, President of SEIU Healthcare, and I'm joined by Michael Hurley, President of CUPE's Ontario Council of Hospital Unions, as well as Andrea Horwath, Leader of the Ontario NDP, Steven Del Duca, Leader of the Ontario Liberal Party, and Mike Schreiner, Leader of the Green Party of Ontario. For some additional background, SEIU and CUPE-OCHU have been bargaining together for over a year on behalf of 70,000 hospital workers. The issues facing our members are not unique to our unions, so I want to recognize ONA and Unifor and others for fiercely advocating on behalf of workers under attack by our provincial government during this pandemic. We stand in solidarity with them. Finally, after very brief 2-minute remarks from all of us, we'll be happy to take questions from the media. If you have any questions, please put them into the chart or raise your hand using the Zoom function, and we will get to you following our remarks. So again, good morning. And in the context of a worsening health human resource crisis, today is about cooperation, not chaos. It's not about partisanship, but rather a plan, or the absence of one, for our universal healthcare system on the brink. It's about action necessary to support our healthcare workers on the front line from a government that has itself been guilty of absenteeism. Enough is enough. We're calling on Premier Ford to immediately recall the legislature for an emergency session to confront the harsh reality of the province's healthcare staffing crisis, starting with the urgent repeal of Bill 124. Bill 124 is more than about wages. It is a hard cap on every single benefit that would support workers right now. Benefits like mental health counseling. I'm hearing daily from registered nurses and registered practical nurses, personal support workers, respiratory therapists, and so many other healthcare workers who are literally breaking down crying while at work. We call them heroes, but forget that they are humans. And despite the welcomed, uplifting words from the public, our provincial government is holding them down. And it's dangerous. Mistakes are happening at the bedside because of burnout, because of short staffing, because worsening employment conditions after 2 years of hell are causing many to utterly collapse. As COVID-19 hospitalizations in Ontario rapidly rise, reaching over 2,000 on Wednesday, hospitals have declared code orange for the first time in this pandemic, because Ontario lacks a human resource action plan. It also means the growing backlog of surgeries and procedures will result in unnecessary suffering and death. Because Ontario failed to plan, 1,000 long-term care staff are off sick right now, causing nursing homes to desperately recruit from fast food chains. And the home care workers whose services keep seniors out of our hospitals is instead at their home, going without a paycheck, supporting their own children because schools are closed. On December 7th of last year, SEIU Healthcare and OCHU held a press conference to warn, and I quote, Doug Ford's plan will result in a devastating healthcare worker shortage. Andrea, Steven, and Mike stand with healthcare workers today in calling for the legislature to be recalled and Bill 124 repealed. Premier Ford, we're asking you to join them at Queen's Park and bring relief and support to healthcare workers now. Thank you so much, and I will now pass it over to Michael Hurley.
Thank you very much, Sharleen, and thank you so much to members of the media for joining us this morning, and thank you very much to the leaders of the opposition parties who've been very vocal on these questions. Today, CUPE and SEIU are calling on the Premier to urgently recall the Ontario legislature and to deal with the crisis in healthcare staffing. This is a crisis which has been years in the making. Going into COVID, Ontario had the fewest number of hospital beds and staff to population of any country with a developed economy in the world, and we had the second fewest staff in long-term care of any province in Canada. These staffing levels leave workloads which are simply impossible and leave nurses, PSWs, and other healthcare workers with what social scientists describe as a moral injury, which is the daily knowledge that they have not been able to provide the care to the residents or patients that they need or should have. The work is physically and mentally exhausting. Most of the work is part-time. 75% of home care workers, 60% of long-term care workers, 50% of hospital workers are part-time. People work multiple jobs. They beg for extra shifts. They don't get paid when they get COVID. They don't get paid when they're waiting for tests for COVID. Wages have been held below the rate of inflation for years now. In 2021, these workers will see a 4% real cut in wages because of Bill 124. All the kind of generous words do not make up for this reality. The safety of these workers has been ignored. Their workplaces have a serious and unchecked problem with racial, sexual, verbal, and physical violence. And during the pandemic, these healthcare workers could not get access to the protective equipment they needed to work safely, even though a Royal Commission in Ontario dealing with the sister virus to COVID, SARS, made recommendations which have subsequently been ignored by this government. And over 26,000 healthcare workers in Ontario have contracted COVID at work, and by our count, 24 have died. This feeling that no one cares about their safety is a key factor in the demoralization of healthcare workers. We saw Quebec deal with the problem of understaffing in long-term care by announcing a year ago the hiring of 10,000 personal support workers into full-time jobs with a salary of $26 an hour with pensions and benefits. 87% of the PSWs they hired have stayed. In Ontario, the targets for hiring do not even match the loss of staff to attrition in long-term care, let alone grow to meet the magical 4-hour care standard the government has set as a target. In Ontario, a comparable move to Quebec's would be to announce the hiring of 14,000 personal support workers. That's what's called for. There is no staffing plan for the hospital sector. And yet all of our internal polling of the 20,000 nurses and 50,000 other healthcare workers that our two unions represent suggests there will be an exodus after the pandemic. This exodus will be driven by frustration over ongoing real wage cuts and the pervasive feeling that no one cares about their safety or that of their family. People are holding on now just out of loyalty to the people of Ontario and to their co-workers. When the Premier suggests that absenteeism among healthcare workers is a major problem, he ignores the fact that these healthcare workers have worked for 24 months with no vacations, on extended shifts, on consecutive weekends, and they are exhausted physically and emotionally. They are vulnerable to falling ill. The Premier ignores the fact that studies show the chance of a healthcare worker contracting COVID in the community is very small compared to the likelihood they catch it at work. And if they catch it at work, it's because they have not been given the protective equipment to deal with an airborne virus 2 years into the pandemic. When the Premier stresses absenteeism, he shows the real face of his government to this workforce. Today, we're calling on the Ontario government to return to the front lines, recall the legislature, put in place a real plan to staff up in healthcare in this province, lead as Quebec has done by creating thousands of full-time, decently paying jobs, repeal Bill 124, which dooms healthcare workers and hundreds of thousands of other frontline workers to real wage cuts. Make safety of this workforce a real priority. Stop rationing protective equipment. Work to stop the violence. Ban the use of agency staff, which bleed off the staffing complements across the healthcare sector. Invest in mental health supports. Offer hope to this workforce. These things will turn the staffing crisis around. And now it's my great honor to introduce Andrea Horwath, the leader of the official opposition in Ontario and of the Ontario New Democratic Party.
Thanks very much, Michael and Sharleen, for inviting me to take part in this morning's press conference. And I just want to start off by saying thank you. I've watched for 20 years or more as both of you have been fighting diligently for your members, absolutely, for all frontline healthcare workers across the entire healthcare system, but also for Ontarians, and to make sure that their healthcare system and their hospitals are at a level of staffing and of the investment that they deserve and need in the face of budget freezes and cuts that we've seen year after year after year. So thank you. Just thank you so much for that important work. And here we are today. Here we are in the midst of a COVID-19 pandemic, a global pandemic that has taken our healthcare system that, as Michael and Sharleen have described, was already on its knees into a total crisis. And that is where we sit now. Healthcare workers are working their fingers to the bone. They are stressed. They are exhausted, and they are leaving the profession. And they are being disrespected, frankly. They're feeling like their government is not there for them. The government talks a good game, uses a lot of great encouraging words, but those words do not translate into actions, and that adds insult to injury when it comes to the sacrifices, frankly, that these frontline healthcare workers are making. And so I'm proud to be here to support you and your efforts and to support frontline healthcare workers across our province. And we all know, as Sharleen was mentioning, the situation that these workers face leads to concerns that all of us have around what that translates to when it comes to patient care, when it comes to the residents of this province and their access to a healthcare system that they should be able to rely on, but they can't. And again, as has already been mentioned, and I'm going to repeat it because I agree 100% with what's been said thus far. The people who are on the front lines of our healthcare system in this province deserve respect. They deserve respect, they deserve support, and they deserve fairness. And they are not getting any of those things. And one important way to show some of that respect, that would then lead to the retention of our healthcare frontline workers, the recruitment of new workers into the field, the return of workers that have already left our healthcare system, is the scrapping of Bill 124. We know that needs to happen. Doug Ford's low-wage policy is a slap in the face to all of those healthcare workers that we laud with words, and words are not enough. We need action. Our healthcare system is falling apart before our eyes, and Doug Ford is sitting on his hands and, in fact, not only not doing anything, but making things worse with Bill 124. And so that's why I have been very vocal for some time now, since we voted against it when it was in the legislature. The repeal of 124 has to be a priority. So I am urging Doug Ford, call the legislature back. Let's scrap Bill 124. Let's make sure we have paid sick days in the province of Ontario, paid sick days to support our frontline healthcare workers who are needing to go off and get some respite or deal with an infection of COVID-19, but also to help parents and other family members to take the time off necessary if they're sick or if their children are sick to prevent the further spread of the Omicron virus. Look, there are many things that we need to do to support our frontline healthcare workers, but what we need to start with is a return to the legislature to get moving on these initiatives. It is unbelievable that Doug Ford is silent, that he's AWOL, and that he has not stepped up to the plate to do the important work necessary to shore up these frontline workers, to shore up our healthcare system, and to make those investments as opposed to cuts, which we've seen for too many years here in the province. So I want to end by saying, I'm here for you, frontline healthcare workers, SEIU members, CUPE members, but all frontline healthcare workers. You know that you have a friend in me and in the NDP, and we're going to continue to fight with you and for you, because that means a quality healthcare system that we can all rely upon. Thank you for your dedication, for your hard work. And I feel very, very badly about what most of you are facing, what all of you are facing on the job day in and day out. My respect for you is enormous.
Thank you so very much, Andrea, and thank you for joining us today. It's my pleasure now to introduce Leader of the Liberal Party, Steven Del Duca. Welcome, Steven.
Well, thanks very much, Sharleen. Good morning, everyone. It's a real delight for me to be here with all of you this morning. Just to echo Andrea for a quick second, I want to thank Sharleen and the team at SEIU and all SEIU members, and of course, Michael and the team and members at CUPE for pulling this morning's event together. And I think that there's actually something quite remarkable that's being demonstrated here today, which I think is a really good sign for Ontario's future. The fact that SEIU and CUPE have pulled together this event this morning, and you have all three leaders of the opposition parties. And I'm also delighted to stand alongside Andrea Horwath and Mike Schreiner, because yes, this is about a healthcare crisis. Yes, this is about dealing with a pandemic, especially in the absence of real leadership from Doug Ford. But this is also about the moral imperative of doing the right thing and standing up for the women and men who have been working so hard and so heroically on our front lines, yes, during the pandemic, but for many, many years. I think we're all on the record as saying quite clearly, we want the legislature to come back. We want to repeal Bill 124. We want to look at all of the other measures that are required to, as Andrea said, back up the words with meaningful, competent, responsible actions. And I think there is so much work that needs to be done. It is a delight for me to be here today. We know in Ontario, this is a very tough moment for the nearly 15 million people who call our province home. But we also know that it didn't have to be this way. You know, I've often believed, I still believe, and I think this is quite clear during a crisis like COVID-19, that it is a core responsibility or obligation of leaders to hope for the best, but always plan for the worst. And what we have seen consistently during this pandemic is that Doug Ford has not done the work that's necessary. He has demonstrated he does not have the capacity, frankly, or the interest to make the investments or the efforts that will strengthen publicly funded healthcare, publicly funded education, and set our province up to be successful in the face of what has been a really, really tough ordeal. So it is important for partners like SEIU, CUPE, and so many others like ONA and the RNAO, and so many others across healthcare, across education, across all of our economy and society to stand together. It's important for the opposition leaders to stand together because this is a moral imperative for us to get this right. Repealing Bill 124, looking for a number of other creative options that have been discussed over the last number of months about how to move us forward, how to get us through the rest of this pandemic, and just as importantly, how to make sure that when we work together collaboratively on a post-COVID recovery, that it's a recovery where we have a publicly funded healthcare system and a publicly funded education system and an economic recovery that works for everyone, that we can actually succeed in delivering that. We know that the status quo, with the kind of leadership that Doug Ford is offering, which is not responsible or competent, is not what the people of Ontario deserve. It is not good enough for any of us. We need to see change in that regard, but that change starts right now. So again, I want to congratulate SEIU and CUPE. It's great to stand alongside my colleagues, Andrea Horwath and Mike Schreiner. I am sincerely hopeful that Doug Ford will do the right thing, and you can rest assured that I, the Ontario Liberal Party, will work with anyone to make sure that Bill 124 gets repealed, to make sure we set the people that we are proud to represent up for success, and to make sure that we get through this COVID-19 ordeal and out to the other side and build a recovery that works for all of us. Thank you very much.
Thank you very much, Stephen, again, for joining us this morning. We really appreciate it. And again, it's my honor to also welcome party leader of the Green Party, Mike Schreiner. Mike, welcome.
Thank you, Sharleen, and thank you, Michael. And I just really want to thank SEIU and CUPE for bringing us together today. I want to sincerely thank my opposition party leader colleagues, Andrea Horwath and Steven Del Duca, for coming together today. I want to thank Ontarians who are working so hard to address the COVID pandemic. And I especially want to thank nurses and frontline healthcare workers for all the work you have done taking care of us over the last 2 years. I mean, all the time, but especially over the last 2 years. And I want to be clear, it is so important at this critical moment that we come together as a province to fight the pandemic and to shore up our healthcare system. And I stand ready to work with members of the legislature from all parties, to blunt this wave of the pandemic and to make sure that our healthcare system has the resources it needs to take care of our neighbors, our loved ones, our fellow Ontarians. And it is so vital at this moment that we as a province show nurses that we have their back. And that starts by recalling the legislature and repealing Bill 124. It is so clear that nurses are overworked, underpaid, and underappreciated. This is wrong, and it must change. And revoking Bill 124 is the start to that change. It shows us that nurses can get the compensation they deserve, and they can access the benefits they need. Benefits like mental health supports, which I know is so vital at this particular moment in time. In the world that we want, healthcare workers feel respected because they are valued. Taking care of nurses means providing patients with better care. It means our healthcare system can retain the people who are so essential and vital to caring for our loved ones. And we know that the system is on the brink right now. And that is why it is so vital that we are here together today, and that we need the government to step up right now, bring the legislature back, repeal Bill 124, ensure nurses have access to mental health supports and other benefits, providing that bonus pay for working short staff, paid sick days, looking at how we recruit more nurses, like internationally trained nurses, for example, to shore up the system. So the choice we face today as Ontarians are we going to act in this critical moment? And I want to thank Andrea Horwath and Steven Del Duca for being here today in solidarity with SEIU, CUPE, nurses, frontline healthcare workers across the province to call for that immediate action right now so we can shore up our healthcare system. Thank you all for being here today. Let's get back to work.
Thank you again, Mike. We really appreciate you joining us today. And I want to again thank the media for joining us this morning. We will now be taking questions, but just a reminder, you can ask your question by putting it in the chart or by raising your hand using the Zoom function, and someone will let you know when it's your turn to unmute and ask your question. And I would just ask you also, if it's directed to one of us, please identify who you'd like the question to go to. I'll now pass it over to Stella. Do you want to take the first question, Stella?
Sure. Please raise your hand in the reaction function, or include your question in the chat, as Sharleen indicated. We're just waiting for people to unmute. If you have a question, please raise your hand. I don't see any questions currently.
Richard Southern here with City News with a question.
Thank you, Richard.
Hi, good morning, everybody. Certainly a little bit unusual to see all three opposition leaders at the same news conference, albeit virtual. I'm wondering if the three leaders can answer this. Is this the start of something new? Are you guys planning to work together in a new way? Are we seeing the beginning of something here?
Can I just want to start by saying that I think all of us and so many others for a couple of years now have been urging this government to do the right thing by Ontarians and fight this virus with everything that we have. And we have not seen Doug Ford take up that call. So myself and the other leaders, but so many others have been urging this premier to do things differently. We've been bringing solutions to the table over and over and over again. For me, today is about standing up for and with and showing my support for our frontline healthcare workers. And that's why I'm here. But I will not stop, and I'm sure the others won't stop either, urging Doug Ford to step up to the plate and to actually show the people of Ontario that he understands what we're all going through, and that he's prepared to listen to not only what the suggestions we bring forward, but there's the suggestions that Sharleen's bringing forward, that Michael has talked about, and that so many experts have been urging the government to act on for 2 years now, almost 2 years.
Richard, if I could also just say, let's be clear. This is not the first time that during this pandemic that the three opposition parties have banded together to work on really important issues. Some of you might remember that back at the end of August, I think it was around August 29th or 30th, three opposition parties came together with many leaders from healthcare, from education, from the municipal sector and the business sector to engage in what we called at the time a vaccine certificate summit. Mike Schreiner was there. Andrea had a member of her caucus there. I was there. The three opposition parties did that work at that point in time. I will tell all of you, I think one of the biggest mistakes, and there's been lots, but one of the biggest mistakes that Doug Ford has made during this pandemic is to not do more effective, genuine outreach to all three opposition parties, to invite us on a regular basis to participate in meetings, to receive regular briefings, so that we could provide our advice, our insight, and our guidance directly. I think throughout this pandemic, what people in our province have wanted to see is that true Team Ontario approach, where we go beyond partisan lines, because these issues that we're talking about, frankly, go beyond partisanship. The virus doesn't care about partisanship. It doesn't care about election calendars, doesn't care about polling. People want to see us work together. So this is not the first time, and I am sincerely hopeful it will not be the last time.
And if I could just add that I think it's just so vital that we show nurses and frontline healthcare workers that we care about them. We respect them. We value the work that you're doing. And we as opposition party leaders are going to come together and fight for you and with you. And so I think this is a particularly important moment with the healthcare system really on the brink, that the Premier sees all of us working across party lines for the people of Ontario, and ask him to come to the table as well and work across party lines for the people of Ontario, so we can shore up our healthcare system and get through this pandemic together.
Colin DeMello, CTV News. Sorry, Sharleen, my apologies.
No, go ahead, Stella.
Sorry, Colin DeMello, CTV News.
Hi, good morning, all. My first question is for Sharleen. Sharleen, we're trying to get a good handle on the actual numbers here in terms of the staffing shortage. Do you have a number of nurses who were in the system before the pandemic and what that number is like now, so we can kind of compare and contrast?
Yeah, Colin, thank you. It's a good question. Well, when we were last polled our members, and I know CUPE's done a number of polling too, we were looking at a turnover rate of up to 30-35%. I'm sure it's more that those that have left are higher than that. We have not had the opportunity to poll. I mean, they're extremely busy. One of the things that we did point out though too, when the vaccine mandates were implemented by the Ford government, and he continues to say that some of the absenteeism is a cause of those refusing to take the vaccine. Even before that, we were seeing 20% in our polls were saying that they were leaving or thinking of leaving, 20% of the workforce then, because of working conditions and lack of support rather than the vaccine. So those are the stats that we have. 35% when we polled them, 20% were leaving not because of the vaccine, but because of working conditions. And I know, Michael, Hurley, you had some stats too that you recently might have done.
Absolutely, but no, that's fine, Sharleen.
Ashley Stewart, Global.
Hi guys, sorry, I was just trying to unmute my microphone. I have two questions, if that's all right. The first one is that you guys are kind of calling on the repeal of Bill 124. Is that going to be enough? It sounds like the problems run a lot deeper than that. Is there, I mean, how do we know that this will work? Is there research that you're drawing on that shows this will be kind of the most effective solution compared to, I don't know, bringing in trainees and internationally trained nurses and things like that?
But I would just say that Sharleen mentioned the polling. The polling we did of our nurses, and we represent 20,000 between us, just one occupational group. And we don't by any means represent all the nurses. For example, ONA has a very large proportion of nursing. 87% said they would reconsider their plans to leave healthcare if they could see a real wage increase. I mean, they've had over a decade of wage cuts in real terms, so this is a factor. The use of agency staff, is bleeding away people who would otherwise be hospital employees and who would be available to work 3 shifts into positions where they are only required to work Monday to Friday, and where they earn significantly more than the people that they work beside, whose wages are restrained by this government. I give you that as an example of something which is a really destructive policy. Mental health support for this workforce, we can't bargain. We're prevented from bargaining. We have no psychological counseling in our collective agreements, and we can't bargain any for 3 years. That's the effect of Bill 124. And this workforce is exhausted. They're traumatized. They're depressed. All of our polling shows, that, depression, anxiety, increased addiction levels are all ways in which this is affecting people. We can't deal with that in a concrete way, and we have to deal with the workload issue, which is at the very heart of the exodus, which is much greater than the normal rate of attrition, which can only be accomplished by staffing up and remedying the fact that Ontario is at the very bottom of the heap in terms of hospitals of any country with a developed economy, like Spain, Germany, Norway, Britain, whatever. So we have to deal with all of these things and full-time employment if we want to have a recipe that actually turns this thing around. So, I mean, the repeal of Bill 124 is central, because if you say that people are heroes and you congratulate them, but your plan is actually to cut their wages by 4% in 2021, prevent them from bargaining anything that would address the mental health and other issues that they have. You don't encourage them to stay, you encourage them to look for other work. And that's what people are doing. And we can't have that. We can't survive as a healthcare system with the kind of losses that we're looking at if this keeps up.
I would just add to Ashley on that. You're right. There is not one single solution for this problem. It's that massive. This is not just a single sector problem. It's not just a problem for hospitals. We need a whole healthcare system solution to the healthcare crisis. SEIU has said for years that there should be universal wages, universal benefits for healthcare workers across the province. A nurse is a nurse is a nurse, no matter where you work. We are in a position right now where these workers, which are very hard to find right now, are chasing the money. The sector that's going to pay them a decent living wage and provide them with benefits is where they're going, which of course has a domino effect on the other sectors. So we need a system-wide across sector plan here. Bill 124 is just one of the solutions. There are many. That's why we want to call people together, all of us here today on this, and other, the Ontario Hospital Association should be there, and the other unions as well.
Thank you, guys. Can I just follow that up with one more question? So I wrote a story about this yesterday for Global News, and one of the replies from the Ontario government was that it's inaccurate to say that Bill 124 caps wage increases at 1% annually, because employees can still receive increases for seniority, performance, and increased qualifications. Is that still happening now in 2021, 2022?
Well, I've constantly said this government has tried to entice people to join the professions by providing education, giving monetary incentives. What we're witnessing now is that people are taking advantage of the education, but what they see is we've witnessed hospitals and long-term care hire personal support workers that have come out of those courses. They stay in the position for 3 weeks and then leave. So, that is not the problem. The incentives that they're talking about is not fixing the solution. We need a sustainable, long-term, realistic plan that is going to want young people coming out of colleges and schools to want to be in this profession, to want to stay in the profession, because they're coming in, seeing the working conditions, and those advancements that they're talking about is not keeping those workers in the workforce. They need to have secure, safe workplaces with a full-time wage. Even the PSW wage enhancement that we've been hearing about now for almost 2 years. I mean, what a way to live and support your family. Are we going to get it? Are we going to keep it? Are we going to keep it? And then there's others who are hearing that there's going to be adjustments because of the PSW. You can't treat these professionals that way in this sector that way. So no, that is not what we're talking about with repealing Bill 124. They need a living wage, they need more staff in this sector, and they need the benefits and protection so that they can provide safe care for the people that they do care for.
And Ashley, I think it's important to note that this isn't like the educational sector where, you're paid more if you have certain qualifications. Like a nurse is a nurse is a nurse, and she doesn't get more because she took a course. She doesn't. That applies to the managerial class, and I'm sure you could have a lot of fun looking at the sunshine list, but the reality is for these people, they're not getting those increases. And even some of the things the hospitals have done over the holiday period, like offer to pay people more to be to work extra shifts, is technically illegal under Bill 124. We can't bargain mental health supports or shift premium increases for these people. We can't. These workers get $7 a visit if they have a back injury and they go for a massage. That what was that cost? $90, $100, $7 a visit. This is an industry, where musculoskeletal injuries are rampant. We can't address that in bargaining. The reality is these people are seeing a wage cut. They are not getting enhancements. They are not getting special increases because they went to school. They are going to school though, but what they're getting in return for that is a wage cut in real terms.
Ashley, any a rebuttal or another question?
No, that's great. Thank you, guys.
Thank you. Adam Donaldson, please. Adam?
There we go. Sorry, there was unmuting issues. My question is for either Sharleen or Michael or both. To address the comment from Mr. Schreiner about getting health professionals and nursing professionals who are accredited in other countries and may have trouble getting accreditation here. What can you say to that as a way to help alleviate some of the stress and bring in some new blood to the health sector?
Well, I mean, right now we need frontline workers, and that's always been an issue in Canada, is that we don't recognize the credentials, and some of them are very relevant and could quickly be immersed into our system. So right now, the crisis that we're in, SEIU supports all of those initiatives. Of course, devil's always in the details, but definitely we are short. We're in a health human resources crisis like we've never seen before. Those are exactly some of the conversations that we need to have at this health human resources table.
But a serious solution requires us to set targets. It requires us to look at curricula. It requires us to move in a direction of addressing domestically, the crisis that we have in staffing. And Quebec shows that if they set a goal of hiring 10,000 personal support workers, they knew that the work wasn't attractive. It was part-time. They made it full-time. They gave people incentives. They did some of the training at work, which alleviated some of the issues around the understaffing. And 87% of those people have stayed. Whereas in Ontario, the attrition rate around people who come out of PSW school, it's depressing, the numbers of people who just bolt after they see what life is really like. So we have to, as a society, set some ambitious targets, and we can fulfill those domestically. And there are a lot of people in our communities who are looking for work, but the work has to be satisfying. And that is a fundamental problem we have at the moment. It's exhausting, it's impossible, and increasing staffing levels would make that a more satisfying job. So we've got to work on that as well. Adam.
Thank you.
Alan Hale, Queen's Park Today.
Hi there. This is a question open for everybody. The text of Bill 124 says that the minister has the authority through regulation to specify that the act does not apply to an employer, employee, or class of employees. So if the government did not recall the legislature like you're asking and simply used regulation to exempt nurses from Bill 124, would that be acceptable?
Well, I'd say that we wrote the Premier in the summer and asked for an exemption for healthcare workers, and he refused. And it isn't just a problem for nurses, right? It's a problem for healthcare workers across the system. In fact, it's a problem for paramedics. It's a problem for childcare workers who are providing the emergency childcare. It's a problem for everybody who's working in the broader public sector. They're all taking these real wage cuts. So so far we haven't seen any willingness on the part of the government to contemplate that, Alan.
Anyone else? Anakul Thakur has a question. What kind of shortages are you hearing from your members? And could you, oh, you're going to ask it. Wonderful.
I was not sure if my mic was working fine. My questions, and Barb has kind of highlighted that, she put that in the chat. I was just trying to understand if you have any data as to what kind of shortage are we talking about, because someone mentioned it's not just nurses, but I want to understand what kind of numbers are there. Are we short on nurses? Are we short on everyone? Are we short on admin staff? What, do you have any numbers for that?
Just long-term care, they're going to need 55,000 people based on the way the work is divided between full-time and part-time at the moment, less if it's full-time jobs to achieve the 4-hour target. 55,000 people will have to be hired to meet the 4-hour care standard. So that doesn't deal with hospitals, and it doesn't deal with the problem in home care. That's just one example, snapshot of one little sector, right?
Yeah, and I would just like to clarify too, I think it was Colin that asked when I said that when we polled our members about why they were leaving, I think I said 20% to every one that was leaving because of the vaccine mandate. It's 20 to the 1, so not 20%. I just wanted to correct that. But the stats that we do have is, you know, a lot of them are pre-4th and now 5th wave. So I'm confident that those numbers are even larger, and you're seeing that. And Michael brings up a really good point. Nursing is a critical part of our healthcare system, but so are all the support services. And, you know, as recently as a few days ago, we've got nursing home operators calling hotels and restaurants to see if they can bring their dietary restaurant staff into the homes to take care of the nutritional needs of the residents. So this is a system-wide, sector-wide, province-wide crisis here.
Thank you. Jeff Gray of the Globe and Mail, are you still having tech issues, or do you want me to ask your question? I'll ask. While I understand the longer term effects on staff retention and so on, am I wrong that replacing Bill 124 actually does little to get us any more ICU nurses and the like to deal with the immediate crisis in hospitals in the coming days?
Yeah, the frustrations that I have is, you know, we have taken every single avenue and road with this Ford government to try and give them the tools, the advice, the recommendations to not only deal with the crisis, but to be proactive and anticipate what the future is. And it's not just about the virus. We've had this problem in the healthcare system for quite some time now. Bill 124 is, and we've been in bargaining, as I said at the beginning. What we're hearing across the table, and I know that other unions are hearing it, is that is the cap. That literally ties our hands with the ability to negotiate benefits like a psychological support. You know, I'm just trying as hard as I can to hold things together here, because it is horrific on the front lines. People are breaking down in their cars. They're breaking down at work. They are literally collapsing. I have dozens of calls a day, counseling frontline workers. This is like these people are coming out of war. They are without a doubt experiencing post-traumatic stress syndrome. Some of them have said to me that after a shift, when they're exhausted, and believe me, it could be an 18-hour shift, they're not even asked by anybody, how are you doing? You know, can I support you? There should be counseling supports on every single ward and every single home for these people. I mean, the most cherished services that Canadians depend on is healthcare and education. And those are the two that I don't know where they find the energy, but they pull in and they provide the services to the best of their ability. Bill 124 is a complete insult on the public sector. I don't know what the agenda was when this bill was passed, but whatever it was, deal with it. You do not say to people that you are heroes and thank you for saving our lives and showing up and risking your family's life during the worst time in our lives in a century. And then when we're there to ask for support, and it shouldn't have to be bargaining, when we're asking for support, they say no, because there's a cap. There's a cap. Well, the cap has been tapped out on health human resources in this province. We are in a crisis like we've never seen before. People are dying, frontline workers are collapsing, and who's going to take care of them? And then, like people have talked about, post-COVID recovery, where are these people going to be to start scheduling those surgeries again, to start scheduling those follow-ups? So Bill 124 is just plain insult. That needs to be the first step. And then we need a health human resources plan that takes a look at the system, where it's been in the past, what we've learned from COVID, and let's fix the darn thing once and for all going forward. These people deserve it, and so do the people of Ontario deserve it. And everyone listening to us today should be calling their Conservative MPPs and say, enough is enough. We want you to act on this.
Would repealing Bill 124 stop some ICU nurses from leaving? I think repealing it would. I think what needs to happen here is a signal, a hopeful signal to the workforce that you know, the government has the back of these hardworking healthcare workers, and you know, to lavish praise on people and cut their wages by almost 5%. You know, which is what happened to them last year, is no incentive for people, you know, to continue soldiering on. So I do think the gesture, I do think allowing us to be able to bargain psychological support for these people and being able to address some of those kind of needs would be meaningful to them. I think they would see that as a signal that maybe things were going to change. And I think that would give them hope. And that's what they don't have. Things are bleak in these institutions, that, you know, they're war zones, and I think people need some hope. So yes, I do think actually fundamentally this would be a very important signal for the government to do.
Can I just say, I agree with Michael and Sharleen, obviously, but I agree with Michael's assessment in terms of retention of existing ICU nurses so that we don't lose any more, but also the return of people who have walked away, of healthcare workers writ large who have walked away because of the exhaustion, because of the stress, because of the mental health crisis that this whole situation has put people in, and that's been exacerbated by a government that has added insult to injury with Bill 124. And I think it's not only a signal or a symbol, but it is a message that you know, that we understand how this government's behaviors have caused this crisis to be worse, and that's a stepping stone to fixing our health human resources crisis going forward. And as Sharleen said, fix the system once and for all, because we all know it has been eroded for years now, and we need to prioritize absolutely frontline nurses, ICU nurses, no doubt, but all of the other frontline workers in our healthcare system that COVID has shown us. We've known all along, many of us, but COVID has shown everyone that these folks are essential to the quality of healthcare that Ontarians deserve and can have if governments make the right decisions.
Andrea, I don't see any more hands up or any more questions in the chat. Any other media wanting to put a hand up? No, I don't see any. Thank you. Sharleen, Michael, are we coming back to you?
Yes, thank you, Stella. Again, I just want to thank all the media for joining us today. Real sincere thank you to all the party leaders for joining us today. And I know one of the reporters asked, is this the new norm? You know, I certainly do hope so. I started the conference today by saying this is not a partisan issue. We need to all step up, and I really hope that the Premier hears this today and that we get a call to bring these people together, and let's really develop the plan now. People need to see hope. They need to see real live action so that when we're all out of this, they know that it's not just words, that we've already begun a plan for them. So I, again, appreciate it. Thank you so much. I'll pass it back to you, Michael.
Thank you so much. We believe change can happen, and we're so grateful to the media for coming today, and we're so grateful to the leaders of the opposition parties, and we're all going to keep pushing. Thank you so much.